Hello everyone, my name is Rasha Buhmeid and I'm going to talk to you briefly about ultrasound-guided lumbar puncture. Lumbar puncture is a very common emergency department procedure which is typically performed via blind surface landmark guidance to help determine the site of optimal spinal needle introduction. However, surface landmark identification of the underlying structure has been shown to be accurate only in 30% of the time. There are certain patient variables such as obesity, generalized edema, prior back surgery are predictive of difficulty localizing these landmarks and therefore making the procedure more challenging and increasing the failure rate. There are other alternatives such as fluoroscopic guided lumbar puncture, but as we know that this procedure is probably not available in most of the hospitals. On the other hand, ultrasound is widely available and can be used to help identify anatomical landmarks. So this is not meant to be a deep dive into the literature behind using ultrasound to guide lumbar puncture, but the conclusions of the study have shown that using ultrasound is going to increase the success rate, decrease the number of attempts, minimize complications from the procedure, and reduce the operator's perceived difficulty of the procedure. In neonates, it's also been shown to help determine the optimal position for performing the procedure. So in the next few slides, we're going to go step by step on how to use ultrasound to help guide lumbar puncture. So first of all, patient positioning. The patient can be positioned either in the sitting position or lateral decubitus position. The studies have shown that sitting position will help open up the intervertebral spaces and therefore make the procedure easier. But choosing which position depends on the patient's condition and the provider's preference. An important point here is actually to maintain the patient in the same position where the landmarks were identified using the ultrasound and performing the lumbar puncture procedure itself. Because moving the patient between both of these identification of the landmarks is going to actually mislead the midline or the identified landmarks. Next is probe selection. You can either use the linear probe or the curved probe. So if the patient with increased body mass, you're going to probably need to use the curved probe because you're going to need to identify deeper structures. Then you're going to identify Tuffier's line, which is this imaginary line between the posterior superior iliac spines, and that's going to help you identify which level of the intervertebral space that you're going to try and identify. And then you're going to start with your ultrasound. You're going to use the probe and you're going to start with a transverse orientation. The goal of this is to identify what is the anatomical midline. So you're going to place the probe in a transverse orientation with the probe indicator to the operator's left. And this is the anatomical illustration of the lumbar vertebral spine. And what you're trying to identify is this spinous process. So this is the ultrasound image that you're trying to identify. And the spinous process is this hyperechoic white rim with the posterior shadow. And once you've identified that, make sure it is in the middle of the screen. And to confirm that this is actually midline, you're going to look for these hyperechoic rims on this side, which are the transverse process of the lumbar vertebra. So again, what you're looking for is this spinous process, which is this hyperechoic rim with the posterior shadow. Once you've identified that, make sure it's in the middle of the screen. And once you place it in the middle of the screen, you can go ahead and use a surgical pen and mark the side of the ultrasound probe right at the midline. So this corresponds to the anatomical midline of the patient. Then you're going to rotate your probe to a longitudinal view. And the goal of the longitudinal view is to identify the intervertebral spaces, the space that you're looking for. And you're going to use the previously identified midline from your transverse view. And what you're trying to identify here is the spinous process, because the space between the spinous process is your intervertebral space. So this is the imaginary ultrasound probe, and this is what you're trying to identify. So this is the ultrasound image that you're trying to obtain. You're trying to identify the superior and the inferior vertebral spinous process, and the space between them is the intervertebral space that you're interested in. Once you've identified that, make sure that you place the intervertebral space in the middle of the screen, and then you can go ahead and mark the skin of the patient using the surgical pen. After that, you can remove your ultrasound probe and continue the lines that you previously marked. And the site of intersection between the lines is the optimal site of inserting the needle. Uh, Remember that you have to keep the patient in the same position that you've identified the anatomy using the ultrasound, as well as performing the lumbar puncture. And another thing is that if you remove the ultrasound gel from the skin prior to marking, it's going to help maintain the ink on the skin. Once you're done identifying your landmark, you can continue and go ahead with your aseptic technique for your regular lumbar puncture procedure. Here are the references that I've used to prepare this tutorial. This is a great video that is published on the SAM lecture series, and here are the papers that I referenced. I hope this is helpful. Please let us know if you have any question. Thank you.